What would I like my sarcoma patients to know? Well, I'd first like them to know that there is hope, that even when things look dark, we're always looking for new treatment options and new ways to improve their care.
Today on Health and Family, we're speaking with Dr. Shantanu Banerji and sarcoma patient Monique to learn more about how genomic profiling is making a huge difference in how cancer patients are being treated.
So sarcoma is a very rare type of cancer that arises from what we call connective tissue within the body. Since these cancers are so rare, it's been hard to conduct large clinical trials that help us determine what the best treatments are for these patients. There are over 50 different sarcoma subtypes that have been recognized. Having such diversity in rare cancers can make finding effective treatments very challenging.
Prior to being diagnosed, I had no idea what a sarcoma was. It's very upsetting when you have 2 young kids at the time, and it's very unnerving to not be able to have a plan. I've never felt in my journey that there's a set plan. The first time I met with the gynae oncologist, he basically told me, he said, "I don't know what I can do for you."
Monique was originally treated with surgery to remove the tumor in her uterus. In 2019, she was told she had 3 tumors in her left lung.
My husband actually passed out in the appointment, and I started experiencing a tremendous amount of pain. I had tumors that were in the lower part of my lung that were affecting my nerves, and morphine wasn't cutting it. I made sure my wills were in order. I had family pictures taken, and during this time, I had met with my oncologist again. And at that point, we prepped myself to start chemo. And his approach all along had been, chemo is not something that your tumors generally respond well to. And his philosophy was, don't give you chemo until we really have no other choice.
There absolutely is a greater need for awareness with regard to sarcomas of all kinds, because it flies under the radar, as it were. One of our goals is to shout about it from the rooftops and to let Canadians know that it's out there. It's important that we grapple with it as much as we can. We've come so far, but we need to go further. We need to find a way to mitigate the pain that the drugs cause, the chemotherapy causes. Cancer researchers generally are so good at drawing connections between different kinds of cancer, sarcoma and otherwise.
In the world of cancer, treatment choice offers hope. Expanded treatment options increase that hope for both patients and treatment providers.
While we were getting ready to give her chemotherapy, we all knew deep down that it was really unlikely to produce any benefit, and the likelihood is that the treatment itself was going to make her sick. So in Monique's case, we looked at the literature, and there were some suggestions that perhaps her type of cancer, in rare cases, might have a particular gene fusion known as the TRK gene fusion. And it just so happened around the time we had to make a decision around treating her cancer that a gene test was available through a program in Canada. And within a few weeks, we obtained the result, and it turned out that her case was positive. And so within a few days of that result, we were able to obtain a drug for her, and that's really completely changed her treatment course.
After testing positive for the TRK genetic alteration, Monique commenced tumor-agnostic therapy, a new type of therapy that treats cancer based on the genetic and molecular features without regard to the cancer type or where the cancer started in the body.
I felt like this massive boulder had come off my shoulders, in that there was another option other than chemo. For 3 weeks, I was basically bedridden on a couch. A good friend of ours had given us Winnipeg Jets tickets, and I thought, well, why not try? I was feeling pretty good at that point, and I was just astonished that I was physically able to do that. The next day, we went and saw my oncologist because he wanted to see how I was tolerating the drug, because it had been a week. And he had laughed at me. He's like, I was watching the Jets game last night, and I'm pretty sure I saw you in the stands.
I won't speak untruths and say that we always have the answer. And still to this day, we have many patients where, despite looking at different treatment options, the outcomes aren't great. Monique is a great example of precision oncology because her case really illustrates the promise that comes with these precision treatments. By finding this gene mutation, we have completely changed the treatment journey for her in the sense that we've been able to provide a treatment that doesn't really have much side effects and has already extended her life by well over a year compared to what we were expecting with the standard treatments.
Like, I strongly am a proponent of people having their tumors tested. My kids are the ones, did you take your medication, Mom? Cancer affects everyone, and it's hard, but being on a drug like this where I've been able to try snowboarding with my kids and go snowmobiling and go skating and, you know, be at the lake and be in the boat and watch them wakeboard and go wakeboarding myself, you know, those are all things that are important for us to do as a family and to be able to bond. And I don't know if I would be able to do that, or even if I'd be here right now, if it wasn't for advances in medicine.
To learn more about genomic profiling within oncology, please speak with your healthcare provider.